Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Remedies Homeopathy. Today we will discuss on one of the common diseases known as lumbar spondylosis, or normally people call it as low back pain. Problem with this disease is previously it used to occur above the age of 60 or above the age of 80 years. So our grandfathers and grandmother used to say that they have low back pain when they are 60 or 70. But now all the younger generation, we are seeing the people as early as 20 years of age with this disease, or mostly 25 to 30 40 years age of people we are seeing with this disease. The main reason for this problem is because the disease is pushed towards younger age group. The first reason is abnormal food habits. Nowadays people are taking lot of carbohydrates, along with that they don't sleep properly, they don't exercise properly, and they are full of stress. These are the four main reasons for the disease. And also having lot of habits, smoking, drinking, alcohol, all these habits are contributing to early onset of this disease that has to occur above the age of 70 or 80 years. The important thing that is going to happen with the younger generation is it hampers their sexual activity. They are not able to perform their sexual activity properly, whether it can be men or women. So that is the main problem with this disease. And coming to the treatment, there is no treatment in allopathy or English medicine or Western medicine where you go to a orthopedician or a corporate hospital nearby you. There is no proper treatment. Only treatment they have is painkillers, or they in advanced cases they suggest for surgery. Other than that, they don't have any other treatment for this, and the painkillers and surgery has lot of side effects. And coming to the homeopathy has the best treatment for this disease. Can be eliminated from the root cause in younger generation, or can be maintained without surgery. See, there is no need for you to go for the surgery. So in future, if you are old age guy and if you are having lot of back pain issues, the allopathic doctors have suggested for you to go for surgery. Mostly you can avoid surgery with the help of homeopathic treatment. If you take homeopathic treatment regularly, there is no need for you to undergo surgery. Basically, this is a degeneration of lumbar spine. You have a spinal column which is on your low back. The part of spine that is present in the lower back is known as lumbar spine. Any degenerative changes means due to wear and tear, the bone get lost here and the disc may degenerate. These changes are known as lumbar spondylosis. Basically, these bones and disc has to be degenerated when you are above 60 or 80 years, but this is happening much earlier now. Degeneration means loss of bone, loss of strength of the bone, loss of density of the bone. All these changes are considered as spondylosis. And coming to the signs and symptoms, the important signs and symptoms are initially all the symptoms are localized. First one is you will have low back pain and stiffness in the back, and also tenderness in the back, and also restriction movement. You cannot turn your waist properly, you have to sit still. So these are the early stage symptoms. And coming to the next stage, what happens is when there is compression on the nerve root, the pain extends from the lower back to thighs, from there to legs, from there to foot. So it is like sciatica. This we call as sciatica. So the pain starts from the lower back and it goes down way to the foot. Other symptoms include muscle weakness. You feel weakness in the legs, and also decreased reflexes. Reflexes decreased means, for example, if you step on any sharp object, you should withdraw your leg immediately. That is reflex. In this case, what happens is those kind of reflexes are diminished because of involvement of nerve. Motor weakness means you feel weakness in your legs. Your legs are not powerful as before. And coming to paresthesia, paresthesia is a group of symptoms where you find weird symptoms on your legs, like something is crawling on your legs, or there will be puncturing with the needles on your legs and thighs. There will be loss of sensation. You don't feel proper sensation on your legs and thighs. They can go numb as well. As the disease further progresses, there will be myelopathy symptoms. Myelopathy symptoms are severe type of symptoms where they can be difficulty in passing urination, and they can be difficulty in erections. You will reduce your sexual activity. There will be difficulty in walking. Your legs become stiff. There will be lack of coordination between the legs, and the legs become weak, and there can be gait problems. You are not able to stand erect. There will be some postural changes. Along with that, you can have pain during sneezing, you can have pain during coughing, and you have pain during vomiting. These are all the common symptoms you find when you have lumbar spondylosis. And coming to the investigation, the important investigations you have to do for this are lumbar x-ray, EP and lateral view. If you take this simple x-ray, most of the details of the disease will be known, like is there any diminished spaces between two vertebrae, or is there any disc degeneration, or any extra bone growth like lipping and osteophytes can be clearly seen in this x-ray. In advanced stages, when there is compression on the spinal cord or compression on the nerve root, you can go for MRI. MRI is the best investigation for this. You can get much deeper into details of the disease you are suffering. Along with that, you need to check for vitamin D levels and calcium levels. These are very important. When you have low vitamin D and low calcium levels, this may degenerate the bone much easily. And coming to the other diseases, you have to rule out some other metabolic disorders. Most of the metabolic disorders can cause lumbar spondylosis. You have to check for PCOD, thyroid, and diabetes, and also other diseases like rheumatoid arthritis and gout. All the other metabolic disorders and autoimmune disorders you have to check as well. In order to know this disease further, you have to know something about anatomy and physiology. Anatomy means normal structure of your lumbar spine. Physiology means the function of your lumbar spine. To understand this disease further, you have to understand anatomy and physiology a bit, that is from the perspective of lumbar spondylosis. Basically, the vertebral column is made up of vertebra. Vertebra is a individual bone. In the lumbar region or your lower back, there are 5 vertebra that is forming your spine. There are 5 vertebra, and these 5 vertebra are placed one below the other, and in between 2 vertebra there is a cushion like structure or a thick cushion like structure made of cartilage known as disc. So along with this, each vertebra will be attached to another vertebra through facet joints. There is a small space or opening between 2 vertebrae. This is known as intervertebral foramen. From this foramen, the nerves comes out of the spinal cord. The vertebra has a hole in it, a space in it where the spinal cord runs. The spinal cord starts at the brain and it runs through the complete spine. At each intervertebral foramen, there will be nerves coming out of the spinal cord. These nerves are known as spinal nerves. Apart from this, there are a good number of muscles supporting your lumbar spine, where these muscles are attached to your lumbar spine through tendons, and there are also a structure known as ligament that will be attaching to vertebral bones. These are all the common structures you have around your spine. And you have to know something about the disc. Disc is a modified cartilage that is present in between 2 vertebra. There are 2 parts on the disc. The central part is known as nucleus pulposus. This is a gelatinous part. It is full of water, and outer part of the disc is known as annulus fibrosus. This is a fibrous part. This is thick. Spinal cord starts at the brain and runs throughout the vertebral column. The space where the spinal cord runs is known as vertebral canal. Spinal nerves comes out of the small openings in between 2 bones. This space is known as intervertebral foramen. And coming to the physiology, the multi-jointed spine or multi-bone spine, which is attached through intervertebral disc. This is the important structure which is helpful in the movement of the spine, where you can bend forward, you can extend backward, you can bend left side and right side, and also you can rotate your trunk. All these are possible because this is a multi-joint. It is not a single joint. It is made up of multiple joints. And the disc in between these 2 vertebra acts as a shock absorber. When you jump, run, walk, anything you do, it will act as a shock absorbent, and it's a cushion in between your 2 vertebra. Coming to the etiology, what are the causes for lumbar spondylosis? First one is unknown. Without any reason, sometimes you can get lumbar spondylosis. Next one is genetic causes. There is strong genetic components. What it means is, if your father or mother, any of your blood relatives are suffering from lumbar spondylosis, you are at more risk of getting this disease. One more risk factor is age. As the age advances, you are at more risk of getting this lumbar spondylosis or spinal degeneration. Lifestyle, especially you are taking more carbohydrate food, you are under stress, you are not exercising properly. These are all the reasons that can contribute to lumbar spondylosis. Obesity, smoking, taking much alcohol, lack of exercise, having sedentary life, especially the women who has menopause or who has removed their ovaries due to any other reason, where the hysterectomy along with oophorectomy has been performed. There can be low amount of estrogen and progesterone. This can lead to bone resorption, and there can be spinal degeneration and lumbar spondylosis because of that. When you have low vitamin D levels and you are not exposing to the sun properly, when you are deficient of calcium, you can land into lumbar spondylosis very easily. There are few metabolic disorders like diabetes, PCOD, or gout, or there can be some autoimmune conditions such as rheumatoid arthritis. This can also lead to lumbar spondylosis. When you have abnormal postures while sitting, while standing, or while walking, this can be due to injury. So any abnormal positions can lead to lumbar spondylosis or degeneration of lumbar spine over a period of time. And coming to the pathology, pathology means the changes that can occur in your lumbar region when you have lumbar spondylosis. First one is there can be spasms of the muscles can become stiff, they can become tender. These are the local changes within the lumbar region. Coming to the bony changes, they can be resorption of calcium. Because of this, the bones become weak and they develop extra bone. This is known as osteophyte. This can compress both the spinal nerve, root of the spinal nerve, and also the complete spinal cord as well. In every vertebra, there are growth plates. When these growth plates become hard, this is known as sclerosis, or it can be known as hibernation. There will be decreased joint space, there will be diminished spaces between two vertebra. And coming to the facet joints are the joints between two vertebra. This can become unstable in lumbar spondylosis. Coming to the cartilage, there is a cartilaginous structure in the joint. This cartilage can become fractured. These are fractured cartilage. Coming to the capsule is a sac-like structure that is surrounding a joint. This capsule can become thick, this can become hard. There can be some hypertrophic changes where the synovial membrane within this capsule can become thick. In the intervertebral disc, there can be dehydration of intervertebral disc. There is lots of fluid in the intervertebral disc. This is known as desiccation. This intervertebral disc become thin. The height of the intervertebral disc is reduced. There can be cracks in the outer part of intervertebral disc known as annulus fibrosus. The inner gelatinous part of the intervertebral disc can come out, and this is known as herniation. This damaged intervertebral disc can put compression on the spinal cord itself, or also it can put pressure on the nerve roots of the nerves that are coming out from the intervertebral foramen. All these degenerative changes can occur. The ligaments that are attached between two bones can become thick and they can become stiff. Coming to the intervertebral foramen, this is a space between two vertebra where the spinal nerves come out and the root of the nerve can be compressed. Because of this can become narrow and there can be compression on the root of the nerves. Because of degenerative disc, even the vertebral canal within the vertebra can become narrow and put the pressure on spinal cord. Coming to the conventional treatment, also known as English medicine or Western medicine, where you go to a corporate hospital or a orthopedician or a neurologist and you take the treatment. This is known as conventional treatment. In this treatment, they give you painkillers, they advise you surgery, and they can advise you physiotherapy. Other than that, they don't have any alternatives for it. So when there is pain, they will just kill the pain, and they don't have any medicines to reverse this pathology where the bone is damaged, the ligaments are damaged, the tendons are damaged, and the intervertebral disc is damaged. There is compression on your nerves and spinal cord where the lot of damage to the nerves and spinal cord. They cannot reverse these changes. They don't have medicines. They have just painkillers. There will be reduction in the pain as soon as you take the painkillers, and the painkillers also have lot of side effects, like it can affect your kidney, it can affect your intestine, it can affect your liver. There are a lot of disadvantages of these painkillers. Other than that, they advise you to go for surgery. You know that surgery is not successful always. There is high chance that if the surgery fails and you will be landing into permanent disability. So in any direction, if you take the treatment with the allopathy, in any direction, there is no treatment for lumbar spondylosis with conventional treatment. We have seen lot of patients who repeatedly take painkillers without any relief. You will get bit of relief when you take the painkillers. When you stop it, the disease again comes and rebounds in much higher way. Your sensitivity to pain is increased now and you feel more pain. And coming to the homeopathic treatment, there is no need for you to go for surgery except in extreme cases where you have a lot of degenerative changes and if there are a lot of injuries. Other than that, for normal, if you are young and if your pain is started recently, there is no need for you to go for surgery. All the damage that is done to your nerves, spine, vertebral column, bone, everything can be regenerated and can be taken back to the previous condition in earlier stages. All this can be done in homeopathy without any single side effect. Side effect free treatment is possible in homeopathy, and the homeopathic treatment is also effective in all the age groups, in all the genders. So basically what homeopathy does is we will try to identify the root cause of the disease, why exactly you are getting this disease, and we will remove the root cause so that you are completely rid of this lumbar spondylosis. And also taking homeopathic constitutional treatment along with few lifestyle modifications, you can prevent the further occurrence of the disease as well. And if you have already landed into this disease, homeopathic treatment will help you to prolong the degeneration. For example, if you are going from stage A to stage B in 2 years without homeopathic treatment, this can be taken to 10 years. That all the degenerative changes which you are going to get can be postponed or can be dragged with homeopathic constitutional treatment. All this is possible in homeopathy even without a single side effect. And coming to the precautions you have to take, first one is exercise. You have to remember that the exercises are done to strengthen your muscle, not to relieve your pain. By strengthening your muscle, you can relieve the pain. It is not that exercises will relieve the pain. What exercise does is it will strengthen the muscle and give stability to your joints. This will reduce the pain. You have to do the exercises only when you are pain free. If you have any kind of pain, you have to avoid the exercises. It is not that you have to strengthen only your back. Entire core has to be strengthened. Your abdominal muscle has to be strengthened. The muscles on your sides of the abdomen has to be strengthened along with the muscles of the back. Entire core have to be strengthened so that there will be stability to your lumbar spine. Mostly you have to do either flexion exercises, extension exercises. You have to avoid rotating exercises, and you have to avoid mostly lateral flexion exercises as well. Mostly you have to do flexion exercises where you can bend forward, and extension exercises where you can bend backward, lateral flexion exercises where you can bend left side or right side, and try to avoid rotation exercises where you rotate your entire trunk to left or right. These kind of exercises to be avoided. For example, when you bend forward, if your pain is increasing, mostly this type of people has to exercise by bending backwards so that your pain is relieved. When you have pain by bending backward, these kind of people will get relief by bending forward. You have to do more forward bending exercises. If you don't exercise your core, what happens is your muscles will not have work and they become atrophied. Atrophied means they become thin and they become weak and they become useless. In order to activate these muscles, you have to do exercise regularly. If by any chance you have started new pain or the existing pain has increased while doing exercises, you have to stop exercising at that point in time until you recover from the pain. Whenever the pain increases after exercise, it can be due to several things. One is wrong exercise is advised to you. You are doing the exercise in wrong way, or you are doing the exercise in a wrong timing. All this can lead to increased pain. You can use lumbosacral belt where there is a belt kind of a thing you can put around your waist. You have to be very careful with this belt. You have to use this belt only when there is acute pain or when the pain is increased. When there is no pain, you have to avoid this belt as well so that your muscles get strengthened naturally. Coming to the postures, how to sit, how to stand, how to lie are very important for the patients who are suffering with lumbar spondylosis. Do not get up or do not sit suddenly. Do not sit or do not lie on the ground, and also do not sit, do not lie on the sofas or chairs or the cots which are very low to the ground. This can put further pressure on your lower back and this can exaggerate your symptoms. So do not do these kind of things. It is very important how do you get up from the bed. It is very important you have to turn to left side or right side and take the support of opposite hand and slowly you get up from the bed. Same thing with the chair. When you are getting up from the chair, you have to take the support of your hands. You have to push the chair with your hands and get up slowly. Do not sleep on the mattress that are sagging. What I mean by this is do not sleep on the mattress that are made up of spring or water beds. It doesn't mean that you put a bed sheet on the flat cot and sleep on it. There is no need for you to do that. You can have a small non-sagging mattress which is 1 or 2 inch thick and you can comfortably lay or sleep on that. There are certain type of movements you have to avoid. Avoid bending forward, avoid lifting weights, avoid sitting in the Indian toilet position, that is squatting position. These are all not good movements. And also whatever the movements you do, you have to do slowly. You should not be jerking and you should not be doing fast or vigorous movements. Coming to the diet, always take low carbohydrate diet. Carbohydrate is one of the major reasons for inflammation and bone degeneration. Take low carbohydrate diet. Take diet that is rich in vitamins, minerals and fiber. You can take plenty of protein. This can strengthen your muscles. And coming to the prognosis, if you don't take treatment as early as possible, the disease may progress in stage. Initially, the symptoms can be localized. After that, the symptoms you experience are the nerve root compression, where there will be pain in legs and also foot and thighs. Once you neglect at this stage, there will be serious complications. There can be pressure on your spinal cord, and in the next stage, you have severe problems like lack of erections, lack of bowel movement, lack of coordination in the legs, and all the symptoms that are related to myelopathy, where there is pressure and compression on the spinal cord. If you don't take care of this at the early stages, surgery is the only option for you. Hi, we are Fidikas Homeopathy. We are a chain of clinics. We offer you two types of treatment. One is online treatment and the in-person treatment. In in-person treatment, you can inquire with us and you can go to the nearest clinic and take the treatment. In the online treatment, wherever you are in the world, UK, US, Pakistan, everywhere, even within any state within India or in Telugu speaking states, you can take an online appointment where you can contact us through audio call or a video call of your choice. If any investigations are required, you can get them done locally and share it to us electronically, where we will be going through all your reports and we will send the medications to your doorsteps itself. Wherever you are in the world, other than India, you will receive the medicines within 3 to 5 days. If within India, you will be receiving your medicine within 1 or 2 days. Make use of it. Thank you.